Oops. Thanks a lot, Christine, for this nice introduction, and also for the project organizers in general for having me. So what I will try to do in this talk is really going a little bit general in terms of health data, genomic data in general, and also including proteomic data, and try to explain a little bit about rhetoric of individual control on how manage actually health data in general, and whether or not the existing and emerging regulatory framework in the European Union will actually help this rhetoric. So to just start, whenever nowadays we are talking about health data in general, that they are generated in different settings. So either in the research projects or in the context of clinical care or even user-generated data, right? We are doing it nowadays very often with even with our, I don't know, smart devices and so on. There is also a question about indeed a need to facilitate secondary use or sharing of this health data. So this is indeed more or less now we are in that point that nobody's really asking about necessity of data sharing. So we all agree that we have to do that. But the problem is, of course, how to do that. That is in an ethical and, legally and socially, it's a responsible way. So basically, we need to make sure that to figure out how that's possible. So it's been already a lot of literature, a lot of studies, evidence showing that we have a lot of problems with sharing data and having access to data. And I will try to just go through some of them very briefly and then go on with specific problems with individual control on health data. So for those of you, which I think that it's from this project is also very relevant that you're working on the more like a technical and more like a scientific part of this project and maybe other projects that you are involved, you probably know that there are a lot of challenges in terms of technical and infrastructure for actually sharing data and having access to data. So part of it is really related to the choice of the platform that you need to make, what type of data sharing platforms that you can have. Should this be centralized? Is it decentralized, federated, distributed? All these new technologies that you can actually have for your data sharing platforms. There are a lot of problems about maintenance and sustainability. For example, so just imagine your project is now for 4 years and you really commit yourself to develop many platforms. But what happens after 4 years when the project money runs out? So it's a little bit like a sad story with a lot of projects, but there really is a big problem for many infrastructure-wise, indeed, aspects of the projects in terms of the sustainability. And then finally, a big problem that we have not only on the basis of just the individual research projects, but many, that in Europe we have a lot of multi-partner projects between different countries, between different institutions. So there's always a problem also in terms of the interoperability of the databases. So whether or not actually we can bring this data from different silos and make them to, just be able to bring them all together. So these are more like in the technical side. Besides that, you may also have already heard or experienced these questions, which I gather them all or group them under the governance of data access challenges. So this is mainly related to the questions that you, in the lifetime of the project, you need to answer that. Okay, so we have these big health databases. They are being generated through the project. Who can have access to this data? Should we have a system of like a controlled access to these databases to just allow like some specific researchers to have access to this data? Or no, I mean, we can go with open access databases. What should be the terms and conditions of access to data, right? Is it like, could we just allow everybody to have access to that? Or no, we just say that if you are, for example, a public funded researcher from university, you can have access to it. And then finally, in terms of the data access committees that you need to have in place, is it good to have a centralized data access committee? Is it good to, like in Belgium, like on a federal level, have like one data access committee to deal with all these questions? Or no, we should really leave it to the any specific cohort or any specific project and PI to decide about it, because at the end of the day, this is the researchers that who collected data, so they know better that how to manage their own data. So they have to really be in charge of the secondary or the decisions about the secondary use of data. So I call those type of questions and dilemmas under the governance, but of course, probably you already noticed that in order to answer some of these questions, you need also to go back and see that what are the legal and ethical frameworks that you have in place, which some of them, of course, for the legal ones is really jurisdiction based. So if you're in Belgium, if you're in Europe, so you have been dealing with some specific regulations that you need to indeed respect them and to be compliant with them. And of course, some ethical norms that these are also important. Some of them are more like you can treat them as global norms, like international, you have to respect them. But in a sense, you need really to know that what are they, because they really impact many of the questions you had also, even in terms of the infrastructure and in terms of the governance. So I've tried to narrow it down a little bit now to some of the indeed very relevant data protection related regulations that we have in place nowadays. And I think I just want to know how many of you have heard, for example, about the GDPR in Europe? Okay, almost like, yeah, majority. So basically, as you probably, as you know, when you are dealing with sensitive health data, so here proteomics, genomics, they are all considered as sensitive health data, you need to make sure that there are a lot at stake, because this can create a lot of privacy-related concerns for the data subjects. That's the terminology that European legislator uses. And this has been, indeed, historically, it has been so, because we always had this feeling that this is a sensitive data, this can be misused. So we need really to make sure that we are protecting it sufficiently when we are using it, when we are generating it in a research context, or when we are dealing with that in the clinical context. So for that reason, and now, well, of course, we have in the European level, we have the European Data Protection Regulation. This has been enforced since 2018. This has already created a lot of headaches. I can imagine maybe for some of you, you have been dealing with some of these issues. And we were kind of trying to figure out or head around it, okay, what we can do with the GDPR and everything. But then European Union decided to just publish so many other data protection related acts in the last couple of years. So I will just focus on two of the very important ones for this discussion in today's talk. So one of them is the European Health Data Space. How many of you have heard about it? Okay, that's good enough. And also the other one is the Data Governance Act, which I will also just touch upon on that, because it's also very relevant for the discussion about individual control. But you should always keep in mind that these are only the ones that they are related specifically to the data protection. And you always need to make sure that there are other, the other relevant regulatory frameworks that they are in place. For example, biobanking laws, or those that are related to research with human subjects, they still may apply in this context. So you still need to make sure that whatever you do with data, this also complies with the other relevant regulations. But I will not go through these extra laws and regulations today. Great. So I think what we have been witnessing in the recent years has been in parallel with all these developments in the legal part, that EU is really involved and engaged in regulating how you can have access to your health data, how you can process your health data. But we have kind of like in parallel another discussion, which is being also indeed being followed by many interdisciplinary scholars. So it's not really limited just to lawyers, ethicists, sociologists, anthropologists. They are all really interested in this discussion about, well, so we are talking about health data. This is a very sensitive data, and we know that, this is of course important for the individuals, but where is the role of the individual in this story. So where we can actually give to the patients or to the research participants the voice to decide how their data can be used in this process of research or in the process of clinical care and so on. So as you see that there have been a lot of also kind of like slogans, not only with the public entities, but also with the private entities. Like this is a slogan from Google, actually, your data, your choice. So kind of pushing this rhetoric that we should really give individuals control on their own data. So they should really be the one deciding what we can do with data. So in order to do that, of course, one part is really to see that, so what's the theory behind it, what's the rationale behind this individual control. But at the same time, we need to have tools, the ethical and also legal safeguards in place to be able to make this happen. So we cannot just say that, okay, I'm advocating for individuals to be in control of their own data, but when it comes to the, the legal rules or ethical safeguards, yeah, I don't do anything about it. So that doesn't make sense. Really, you need to make sure that what can help to make this happen. And also, I think that this is interesting to know that currently there are also a lot of projects and initiatives. I think Vito is also involved in one of them, of course, related to building some infrastructure as well to allow this individual control. So this idea about having personal data vaults that individuals really to be able to have a copy of their health data and then decide for themselves if they can share it with others or not. And it's interesting to know that I think in the last couple of months, at least 3 startups contacted me with the same idea. So they're actually doing it from a private industry, from the industry perspective, that they are really building these data vaults, and they want to, all their idea is that we want to give individuals control on their data. And they want to know that how they can actually navigate the regulatory framework around it and so on. I have to always say good luck with this maze of really regulations that they have to, just be able to manage. And at the same time, there are also other tools as well. For example, like a dynamic consent. This is also a tool that recently is being developed with some researchers, some colleagues in the ethics part of it in the University of Oxford. They have published many papers explaining the concept. But the idea is that really, in order to make this happen, we should also distance ourselves from just a paper-based, one-time informed consent in the beginning of the study, but to have more like an electronic version of it to allow patients and research participants to go back to their consent form to see that what's now happening with their data, and then on a case-by-case basis, on a project-by-project basis, for example, opt out from a specific project and say, okay, I don't want, for example, this project use my data and so on. There are a lot of discussions around it, again, about whether or not this is really feasible to use this dynamic consent in all settings, but I just leave it here. Great. So now what I want to do in the couple of next slides is to challenge you a little bit about whether or not actually this idea of individual control is a good idea. It's really, we can actually, it's something that we want to pursue. And if we want to do that, what are the specific concerns or considerations that we want to keep in mind? So the first one is really related to this nature of the health data. So I think more that we push in the direction that we're just talking about health data as something that has an individual value. It's something that me as a patient or research participants, this is my data, have to decide about it. I think we may actually lose sight of the other aspect of the health data, which is its public value. So basically, we just experienced it right during the pandemic that we had to really give up on many of our privacies on our health data because we needed to share this health data to combat, for example, a public health emergency. But that was not the only one. So if you have done COVID tests during these 2 years, probably you have seen in the consent forms that it was also a clause that whether or not you are, this data can be also used for the health research afterwards. It can be shared for different studies, and not only just for these specific test purposes, but also for the different research projects. So in general, I think it's a little bit, it's not really accurate for me to say that health data, it's really has only individual value. It has really very strong public health related value. And it's very important also to advance scientific research. So in that sense, we really need to make sure that whatever rhetoric that we are indeed promoting, it doesn't really ignore that aspect of the health data. And this is something that it's nicely being explained also with many colleagues under the social value of solidarity, which is, it's one of the very important, of course, values, at least in the European context. Many colleagues like Barbara Prinsack in the University of Vienna, she's published extensively on this topic, that we really need to make sure that, what are the conflicting values as well, how this can impact actually the concept of solidarity. That if we give too much, if we go more in the direction that this is just individuals that they decide about what they can do with data, then what would be downstream impact, for example, on scientific research and the values like solidarity. The second problem and concern, which I think it goes also in a practical aspects of how we really want to manage these individuals' control on their own data, is the existing asymmetry of information between the individuals, patients, research participants, and the data holders. So I think that if you really, even for us that we are somehow like dealing with health data on our daily job, if either you are a researcher, you are generating data, I don't know, even I'm a legal scholar, I'm looking at the legal aspects of how to manage health data, but we are never always aware of all the different aspects of this data processing that happens with our own data. I think all of us have had experience of going to the hospitals, really just signing the consent forms. I don't know how many of you have actually sat there and read the consent forms from the beginning to the end. Even me, sometimes I feel, okay, this is my job actually, just looking at the consent forms. I never ever really read one consent forms from the beginning to the end, So then this brings the question that, well, how much of this really individuals' control would be informed choice? And how much we have to really push individuals to be informed about all different aspects of data processing, right? Could we really explain them, for example, well, we are using these federated networks, we are really not sharing data, it's really data somewhere else, but we are sending, for example, queries and they are responding, nobody sees your data, just how much we can actually take time to explain all this and how much even individuals are willing to take time to learn about all these aspects of data processing and concerns that can create, for example, for data protection, for privacy, potential misuse of data, and so on. So this really brings a question about, and I think I'm very puzzled with that, how we can really solve this, because we are just pushing for individuals' control, but we cannot really educate patients and just all individuals about all these aspects of data processing. And then the other aspect, which is a little bit goes more like in a theoretical or more philosophical level as well, is the ambiguity that we have about some of these key terms that we are using a little bit in a liberal way. So we say data ownership. We are owner of our own data, or there is a property rights, on our data, and so on. These are very, very ambiguous words, and when you want to translate them in the regulatory framework and in the legal context, they are even wrong. So let's say that in many of the, for example, European context and European legal systems, we never have even a concept of ownership of data and health data for the individuals. what we use is a different sort of privacy and data protection rights that they are being respected under the fundamental rights. And then we have an instrument now, which is the data protection law, which helps to recognize different rights that you have under that. So, for example, your right to access to your data, your right to, for example, the right to be forgotten, the right to erase your data. But we never really talk about, for example, in the GDPR, there is even one time the mention of your owner of your data. And it's similar for the property rights. This is also very philosophically, this is a very indeed, it's a concept, it's a right that it sometimes is being considered as a bundle of rights. So you have different small rights under the property rights. And here in the context of health data, sometimes we have challenges as well to really, justify that we have all those, the elements of the property rights under the health data, which I will just explain one of them, which is related to whether or not you can actually sell your data, the monetary part or aspects of your health data. So that's a big discussion. We should be very careful with choice of our words. Maybe we are talking really about custodianship. This is not really ownership. Or maybe under the ownership, what we are aiming to justify, it's really controlship, that really just that aspect of controlling data, but not much about really owning data in a sense that you can, for example, resell your data, or you get some, for example, monetary benefits for your data and so on. So yeah, it's just, it's something that's also very ongoing discussion. And again, this is, it's interesting to see that because there are a lot of interdisciplinary contributions to this topic, from sociology, from bioethics, from law, but sometimes really this is just a misunderstanding between these dialogues, that what they mean actually when they use the term ownership. Then this brings me to the element of commercial value of health data, because this is somehow in some of the initiatives that they were pushing for this individual control of their data. What is also important for them to introduce this aspect too. So to say that, well, if I'm the one that control how my data can be used, then I should be able also to do whatever I want to do with my data. So for example, I should be the one to say that, well, you have a research project, you come to me, you have to pay me actually to be able to have access to my data. I mean, why not? And especially because, interestingly enough, of course, in the US, there has been some initiatives, there are some startups that they are kind of operationalizing this idea. So there are few startups. So we looked at them in 2019, I think, in this paper that I just included here. And we wanted to see that, well, what is the business model of these initiatives? So what they do is they encourage you to, for example, if you have access to your own genomic data, if you have got it from direct-to-consumer genetic testing companies, from 23andMe, or if you are in a setting that you can have access to your full genomic data, not only the end results, to be able to upload this data in their system. And then they kind of act as a broker. So they bring different pharmaceutical companies, biotech companies that they are very interested in having access to data. And then they say, okay, you can share your data with these companies that they are interested, and you can get something in return. This could be, for example, some share of the company. It could be some tokens. It could be some free genetic testing. If you haven't done your genetic testing, you do it for free, and then, but in return, you can actually, just share your data with these companies, and somehow, you get something from this. So this is very interesting discussion, of course, and I know that some also in Europe are trying to kind of introduce some model of this individual control that leads to as well to for individuals to be able to get indeed some if there is some profit from their data by the companies, they should be able also to share this profit also with the individuals. But I think if you look at it from the ethical side, this is of course very questionable. This is mostly because, especially if you really introduce that in the context of research and scientific research, we know that historically, like paying individuals to participate in research, not just reimbursement for their time and expenses, not that part, but really paying them to do such a thing has been historically really frowned upon, because it's been always the idea that this can actually impact whether or not your consent is really informed or is really coerced. And also there's this discussion that maybe at the end of the day, those people that they opt in to do this, those that they are really in need of money. So then are we making privacy something as a luxury good? So some people can afford it, those that they don't need really to sell, for example, their health data, but not the others. And of course, on a very practical aspect, how we are going to evaluate the value, the monetary value of your data. If you have like some rare diseases, should I pay you more because like your data is really like very special, or how we really going to evaluate or assess the monetary value of your data? So there are a lot of questions around it, but again, it's just good to know that yeah, there are some initiatives that they are experimenting with this thought, and yeah, it could be indeed also associated with this idea of individual control. And then yes, the final concern, which is it's not directly related to the individual control rhetoric, but it's something that I've been really struggling with that in the recently as a really problem of many of these genomic and health databases. And I'm really wondering that how this individual control rhetoric will impact actually this, will exacerbate this problem, will improve it, what will be the impact? And that's really related to the lack of diversity and equity related concerns. So we know now for a fact that, for example, many of the genomic, and I'm not sure if it's the same as well with proteomic, but these databases are just majorly representative of people with European ancestry. And these are not really representative of many other ethnicities. So this means that at a later stage, when it comes to developing genetic testing, let's say for example, developing some polygenic risk scores and so on, these are not of utility for those that they are coming from these diverse ethnicity and racial backgrounds. And also, this is not only only part of the diversity. We know that in terms of the socio-demographic attributes as well, also we have problem with diversity. These are also important, for example, about different health markers like your, I don't know, obesity or smoking habits and so on, or other factors that can impact your health as well, like income and other things. And there are also questions about whether or not the databases that we have, all these health databases that we have, they are also including really all these different, populations and different groups from these different subgroups. So this is something that for me, it's very interesting to see that how this individual control rhetoric can impact it. Will this cause to many subgroups, subpopulations to trust more the system, or to be more involved in this discussion, in the research studies, in the data collections, or no, it will just really further exacerbate these problems, because then this will not be some of these subpopulations, maybe they will not be in a position to be able to be part of this individual control because of, I don't know, maybe lower education or lower access to some technologies. Just imagine if this individual control is controlled by different apps and different sophisticated, I don't know, something on your smartphone and stuff like that. So how these two will go on. But this is something that I don't have really an answer to that. So yeah, these are the concerns that I feel they were the major ones. And we are, of course, interested to see that these regulations in the European Union, how they will impact or this individual control idea. So I will just focus on very specific, two specific issues, one from the European Health Data Space, which is related to the consent, and then on the Data Governance Act under the concept of data altruism, because I think these two really interesting for the discussion about, about how we can have this individual control. So for the European Health Data Space, for those of you who have heard about it, it's super ambitious plan from the EU. They want really to build not really infrastructure in itself, but really like a kind of ecosystem to facilitate access to and reuse of health data for improved healthcare delivery, improved research, and better health policy making. So just the biggest difference between the GDPR and European Health Data Space is that, so that one was general, it was not health specific. This is the very first health sector specific regulation, which will be even globally, I think, something very unique. And like the GDPR, this will be a regulation. So this means that this will be enforceable in all 27 member states. It has two big parts. First part is the primary use of health data, and the second part is the secondary use of health data. So the first part is anything related to clinical setting, when you go and in the hospital, in your GP, you get care. And then the second part is related to whatever you do for example, sharing data for research purposes, for example, specifically for developing AI tools. This is also explicitly mentioned there. And anything that you can actually do in that sense with health data. I already mentioned this. So this is very broad in terms of what you can do in terms of the secondary use of health data. So in the beginning, I think the rationale behind everybody was asking why European Commission is doing that and how this will really go along with the GDPR. And the first impression was that hopefully this will help to address three big problems that we have now with the GDPR when we are dealing with the health research data. So the first one was, I don't know how many of you have been engaged in some multi-country projects between different EU. Yeah, I see that. Yeah, enough. People do see that there has been sometimes really problem with, so let's say in Belgium, you go to your data protection officer in the hospital or in university, should I, for example, is it okay for me, for example, to share my data? Is it okay if you just put this is data for research purposes? And then you have a researcher in Germany says, no, for the data protection officer, they have very specific rules about how you can actually define consent if you want to eventually put your data in some public databases. So there were a lot of questions about, okay, how we can really manage this multi-country project. So we're really hopeful that, European Health Data Space will help to solve this problem. The second one was, probably you have heard, under the GDPR, you can use different legal bases to collect data, to share data. One of them is the consent. So, and it's very strict. So your consent, in order to be valid, it should be informed, it should be specific, it should be, you have like very specific criteria for the GDPR. But there were also other options that you could use, which one of them was for the public interest. So there was kind of like an option that really go around consent as a legal basis for data sharing. But this was, of course, creating, again, confusion. Can I go with public interest? Is it like is this project is okay? We have industry involved. Is the public-private partnership, is it okay if we go with public interest, for example, or not? So a lot of discussion around it. And then finally, the terminology itself. So GDPR says, well, it doesn't really focus that much on the data sharing. At certain points, it talks about further processing of data. So this is the terminology that the GDPR uses. But for those of you who are involved, I don't know, in some of the data sharing projects, FAIR project and so on, you know that its terminology could be very diverse. So you could say, is it really data sharing? Is it secondary use? Is it further use? Is it really not really data sharing? Is it just considered as really like just a new project, for example? So that was also another aspect that European health data space could actually, address it with bringing some unity. So we waited because they announced the initiative in 2020, February 2020, and then after a long wait in May 2022, the European Commission has published the draft proposal for the European health data space. So of course everybody was waiting to see that if the expectations are being fulfilled, with this new regulation. I'll try to just highlight some of the points that we see now in the current draft. But you should know this is just a draft. So just to give you an idea, if you compare it with the GDPR, it took 4 years after the first draft to see the final regulation. So for this one, give and take, I think we should expect even many more years. So in the first draft, indeed, it was very obvious that the regulator wants to use public interest as a legal basis for indeed for secondary use of data, and to distance indeed from the consent as a legal basis for data sharing. So some found this a good approach because we know that, I think as researchers, you know that it's not always easy to really make sure that you can obtain a valid consent, right? You need to have a very specific consent. Sometimes you have databases from the past, so you don't know if you can use them. These are the legacy databases and so on. So, but for others, especially those that they're really pushing for the individual control and really individuals being in charge, they really criticize this approach of the European health data space. So they didn't find it a good approach. And also, there's not much about, okay, what is in this for the patients, for the research participant. So really, because it has very strong public interest sentiment in that, so you see that it feels somehow that, yeah, you are really, especially for the secondary users, this is being done because you need to do this to advance science, you need to do this to help, public health and so on, but not much really focus on how individuals can be actually active actor in this data ecosystem. So this is also a part that in the recent commentaries that's been written so far, it's been really highlighted as a problem. Also the last part, which I think it's also very interesting, is that, so basically, let's say that it's the public interest, you don't have a consent, but still you need to just give some information to the citizens, right? That we are using your data, really, we are just something happening with your data. So this is mostly, it's related to the right to information of the individuals, right? I need to know that what you are doing with my data. It's a bit separate from the consent that I really decide what you do with my data. And interesting difference now in the European health data space is that you don't need really to go to every individual, to me, like sending me like one specific, letter to me as like individual citizen, say that what you do with my own data, but you just need to give some general information about to the general public about what's happening with, for example, in this specific hospital or in a specific group, but nothing really individual level information, which was different from what we had under the GDPR, that you really needed to provide individual level information. So that's why some believe that this is actually going against the concept of transparency. And we all know that transparency, of course, is key. It's very important. And there's been many projects in different countries that because that they didn't really have a good level of transparency, they lost public trust and they had to really shut down the project, for example. A care data project in the UK is one of the examples. Then my last point for the Data Governance Act. Okay. Basically, so this is another just really regulation. It's general again, it's not specific to health, but because it talks about data sharing, it also, we need to, any health data sharing should be compliant with this one too. And it's interesting, this is for first time it introduced the concept of data altruism. And the idea is that, well, where you have data that you make it voluntarily available by individual or companies for reuse without compensation for the common good, such as for science and scientific research or improving public services. So the regulation used data altruism as a terminology, but similar concept that you can see in the literature maybe is data solidarity. Maybe this is, we could try to see that if this is actually related to that concept. So there has been a report as well. For those of you who are interested, I will not go through it, but it was a survey of the different EU member states to see that how they are managing health data. And in that report, they said, well, there are already some examples of data altruism. They mentioned there is one in Denmark, there is another in Germany, but now this is questionable because this report came before the Data Governance Act. And some argue that maybe these examples are not necessarily really aligning with how data altruism is being defined under the Data Governance Act. But just these are the only things that we have at this moment. So I included here if you just for your own reference. So yeah, I think that here as well, it introduces two things. So to have a European data altruism consent and also the purpose of general interest. This is also coming under the Data Governance Act. Again, there is a bit of question here that what do you mean with data altruism consent? We already have consent for the GDPR purposes. Do we need another consent if we want to share data? Is it like this data altruism consent is again another layer of consent? And of course, I think researchers are terrified to see this if you really want to go for another layer of consent in this context. And so we're still trying to figure out what is the function of this data altruism consent. Some argue maybe this is just extra safeguard. It's not really considered as a legal basis. And some, those that are in more like optimistic ones, are saying maybe this is a good thing. Maybe we can actually use this and harmonize consent for once on the European level. I'm not sure it's gonna work, but this is something that I feel that this is really just keep some positive note here. And then finally, the concept of general interest. Again, Data Governance Act doesn't define it very well. And for all of us, it's really important to know what is this public interest? What is this general interest? Especially because I think probably you have also experiences in many of the projects that you are involved. There are also partnerships with industry, right? You have many different companies that are involved in these projects. And there's always this big question that, is it still okay to use public interest or general interest when we have companies and private entities in this story? So this is also something that, it's not very clarified under the Data Governance Act. And something that, again, many didn't like it. It's, again, using a new terminology. Is the difference is subtle, but they are using a general interest, while the GDPR used the public interest. So this is, if you really want to very specific from the legal perspective, this is also a question that, are they the same things or not? So to just conclude, I think that based on all this discussion that we had, I think that for any type of data sharing, I feel there are three main pillars that we need to make sure that they are in place, whatever we do. So the first part, lawfulness, is really about the part that we get it right, that do we use consent as a legal basis? Is it public interest? Or whatever we do, we need really to be clear about what this involves. A safety part, I think that many of you are dealing with that, the technical and organizational safeguards, how you are really building the platforms, databases, that they are safe, they are not going to be, hacked for different security measures. And finally, fairness is something that we are recently dealing with that. So I have Pachi here, my PhD student, she's working on this project. And we want to see that, so we hear a lot, fairness is important. We need to be fair when we are sharing data, when we are dealing with health data. but what does really that mean in this context? So this is something that I feel this is, yeah, we need also to clarify it and make sure that we are also living up to that. So these are just few points I think that maybe already comes in the question or something that for further thoughts. So probably already just thinking all these regulations, what does this mean? Should we just follow one, or is one more important than the others? As actually no, we need really to have interplay of these different regulations. So this is something that it will be very important. So they have to really get along with each other. We cannot really say that, okay, I'm just doing what GDPR says, but not, for example, what European Health Data Space says. No. Again, the concept of data altruism, very interesting, but what does really that mean? And importance of transparency, I already mentioned, and yeah, this public-private partnership and its impact on the public interest, something that it's also we need to, yeah, just clarify it as well in this context. I think I went over time, sorry, but if you have any questions, I'd be happy to answer. Yes. Mm-hmm. Yeah. Data governance, I think. Mm-hmm. Mm-hmm.